know in the chat when that is started? Oh, great. Okay. The recording has been started. Unlike Zoom, we will not be seeing, we won't be getting told verbally. However, I do see a recording and transcription notice up on the top, and I hope everybody else does as well. Good morning. This is the hearing for Paramount Operations BBD LLC, doing business as Paramount Wellness Centers, docket number 25-32820-CON. Good morning, everybody, and thank you for being here. Paramount Wellness Centers, the applicant in this matter, seeks a certificate of need for the establishment of a new healthcare facility under Connecticut General Statutes, Section 19A-638, small a, 1. Specifically, the applicant seeks to establish a new healthcare facility to treat individuals with mental health and substance use disorders. Today is January 13th, 2026. My name is Alicia Novi. Amy Porter, the Acting Commissioner of the Office of Health Strategy, designated me to serve as hearing officer in this matter, to rule on all motions and recommended filings of fact and conclusions of law upon completion of the hearing. Public Act 21-2, as amended by Public Act 22-3, authorizes the agency to hold a public hearing by means of electronic equipment. In accordance with this legislation, any person who participates orally in an electronic meeting shall make a good faith effort to state his, her, or their name and title at the onset of each occasion that the person participates orally during an uninterrupted dialogue or series of questions and answers. I'm just going to repeat that because we are doing an AI transcription today. It is very important that before any witness or anybody speaks that they state their name and title so that we can have it for the record. We ask that all members of the public mute the device they are using to access this hearing and silence any additional devices around them. This public hearing is held pursuant to Connecticut General Statutes, Section 19A-639A, small f, 2, which provides that HSP may hold a hearing with respect to any certificate of need application submitted under Chapter 368Z. Although this is a discretionary hearing, the manner in which OHS conducts these hearings will be guided by Chapter 54 of the Uniform Administrative Procedures Act, also known as the UAPA, and the regulations of Connecticut state agencies, Sections 19A-9-24. The Office of Health Strategy staff is here to assist me in gathering facts related to this application and will ask the applicant witnesses questions. At this time, I'm going to ask each staff member assisting with questions today to identify themselves with their name, the spelling of their last name, and OHS title.
Good morning. Stephen Lazarus, Lazarus. I am the CON Program Supervisor.
Good morning. My name is Annie Fiella, F as in Frank, AIELLA, and I am the CON Team Lead.
Good morning. My name is Andrea Harrison, HARRISON, and I'm a Planning Analyst.
Also present is Faye Fentis, who is assisting with hearing logistics, gathering the names for public comment, and providing miscellaneous other support. The certificate of need process is a regulatory process, and as such, the highest level of respect will be accorded to the applicants, members of the public, and our staff. Our priority is the integrity and transparency of this process. Accordingly, decorum must be maintained by all present during these hearings. This recording is being transcribed and recorded. The video will be made available on the OHS website and its YouTube account. All documents related to this hearing that have been or will be submitted to OHS are available for review through the Certificate of Need CON portal, which is accessible on the OHS CON webpage. In making my decision, I will consider and make written findings in accordance with Section 19A-639 of the Connecticut General Statutes. And lastly, as you were notified at the beginning of the recording, there should be a pop-up that either showed up when we started recording at 9:30 or when you join this meeting that lets you know that a transcription and a video are being recorded of this hearing. If you wish to revoke your consent, please do so at this time by exiting the Teams meeting. At this time, I'm going to let you know that if you would like to sign up for a public comment, you can do so using the Q&A section at the top of the page. The chat has been disabled, so you will not be able to use that. However, if you put your name and that you would like to make a comment into the Q&A, Ms. Fentis will go ahead and put a list together of anyone who would like to make a comment. Going to start by going over exhibits and items of which I'm taking administrative notice. Then I will ask if there are any objections. The CON portal contains the pre-hearing table of record. In this case, the exhibits were identified in the table from A to R. We will also include Exhibit S, the Hub 2025 Priority Report, and Exhibit T, Public Letters of Support. Additional letters of support were uploaded late yesterday and will be given an exhibit number as well. Attorney Fusco, would you like those to replace current Exhibit T or be entered after Exhibit T?
Hi, this is Jennifer Fusco, counsel for Paramount. You can swap them out. They include the letters that were in Exhibit T plus some additional letters, so you can just swap out that for the current Exhibit T. Great.
After this hearing, we will make sure that the letters uploaded yesterday are marked as Exhibit T. All right, Mr. Lazarus, Ms. Fiala, and Ms. Harrison, do we have any additional exhibits to enter into the record at this time?
No, we do not.
No.
Okay. The applicant is hereby noticed, and I am taking administrative notice of the following documents: the statewide healthcare facilities and services plan and its supplements, the facilities and services inventory, OHS acute care hospital discharge database, the all payer claims database claims data, and the hospital reporting systems financial and utilization data. I may also take administrative notice of other OHS decisions, agreed settlements, and determinations that may be relevant to this matter, but which have not yet been identified. I will, as stated earlier, Attorney Fusco, give you a chance if I notice any of those or use any of those to respond, should you want to.
Thank you.
Counsel for the applicant, Paramount Wellness Centers, can you please identify yourself for the record again?
Jennifer Fusco, counsel for Paramount Wellness Centers.
Thank you. Are there any objections to the exhibits in the table of record or the administratively noticed dockets or documents?
There are no objections, provided we make the swap of Exhibit T and based on our prior conversation that we be given an opportunity to respond to any administratively noticed information that you would like to use in a decision.
All right. With that, we will mark all of the exhibits as full exhibits, and we will take care of swapping out Exhibit T after the hearing. Attorney Fusco, do you have any additional exhibits you wish to enter at this time?
No, I do not.
Okay, we'll proceed in the order established in the agenda for today's hearings. I'd like to advise the applicant that we may ask questions related to your application that you feel you have already addressed. We will do this for the purpose of ensuring that the public has knowledge of your proposal and for the purpose of clarification. I want to reassure you that we have reviewed your application, the completeness response, and the pre-filed testimony, and I will do so again many times before issuing a decision. As this hearing is being held virtually, we ask that all participants, to the extent possible, should enable the use of video cameras when testifying or commenting during proceedings. Actually, I'm going to just restate again that we do ask that you state your name at the beginning of any commentary for both our record that's being generated electronically and for everybody listening in. All right. All participants in the public should mute their devices and should disable the cameras when we are going off the record or to take a break. Please be advised that although we will try and shut off the hearing recording during breaks, it may continue. If the recording is on, any audio or video that has not been disabled will be accessible to all participants. Public comment taken during the hearing will likely go in order established by OHS during the registration process. However, I may allow public officials to testify out of order. I or OHS staff will call each individual by name when it is their turn to speak. Registration for public comment can be done using the Teams Q&A function. Please list your name and that you would like to make a public comment in the message. Public comment will start once we have finished applicant testimony, and then we'll go before closing statements. The applicant's witnesses must be available after public comment, as OHS may have follow-up questions based off public comment. Anyone listening to this hearing who would like to submit written comments in lieu of speaking today, you may do so by emailing your comments to concomment@ct.gov. Again, that is concomment@ct.gov. We'll now move to the technical portion. Is there an opening statement from the applicant?
I do not have a legal opening statement. I'm going to defer my time to my clients. We have two witnesses. Christopher Bartler, who you can see is on Teams and has his camera, and Cece Ruella, who's here with me in the room. So if you'd like to swear them in, they can each summarize their testimony for OHS before you ask questions.
All right. So I'm going to, all right. I'm going to have you both raise your right hand. Mr. Bartlett, I am unable to see you at the moment. If you could just make sure your camera is on and that your audio is on.
Okay, sorry about that.
No problem. All right. I'm going to ask you to both raise your right hand. So if you could make sure I can see your hand come up. All right. Do you solemnly swear or something? Actually, I'm going to have the Zoom room just kind of, there we go.
Should I mute? Or?
Yeah, mute for a second. And then once I say their names, you can unmute and they can say, I swear. All right. Raise your right hand. Do you solemnly swear or solemnly and sincerely affirm, as the case may be, that the evidence you provided in your pre-file and the evidence you shall give or have already given in this case shall be the truth, the whole truth, and nothing but the truth, so help you God, or upon penalty of perjury? I'm going to go to the Zoom New London room first for Miss Ruella.
I do.
Great. Mr. Bartler, if you can just, hi, I actually can't see you raising your hand, but if you could raise your hand closer to your face so we can see it, and then say that you do.
I do.
I think his screen might be frozen. I think that might be
so
the
too.
problem.
All right. We will just note for the record that he's a little frozen, and that's okay.
We'll come back.
I just want to make sure that
I do.
Thank you. We've got you.
Did you get me with my hand up?
Chris,
no,
maybe
I think your screen is frozen.
Yeah, Chris, maybe if you shut your video off, turn it back on, it'll unfreeze.
Okay, one sec.
Oh, there you go. You're back. There he is.
Okay.
I do.
There you go.
Great. Thank you.
Perfect.
Okay. We just want to make sure that when giving your testimony, make sure to state your full name and adopt any written testimony that you have submitted on the record prior to testifying today. The applicants may now proceed with their testimony. I'm going to ask that the witnesses define any acronyms for the benefit of the public and the clarity of the record. I'm going to mute my mic so that your witness doesn't hear me reverberating.
Chris first.
Yes, perfect. So Chris, you can go first. I see you keep freezing, but it's okay if you do. We can hear you.
Okay. Good morning, Hearing Officer Novi and members of the Office of Health Strategy staff. My name is Chris Bartler, and I'm one of the founders and co-owners of Paramount Wellness Retreat. I also serve as Paramount's Chief Financial Officer. I hereby adopt my pre-filed testimony. Thank you for the opportunity to give me brief opening remarks about our proposal to establish a comprehensive outpatient behavioral health center in Stamford that will provide multiple levels of service to patients with substance abuse, mental health, and co-occurring diagnosis. In June of 2022, OHS approved Paramount's CON to establish a detox and residential program in Haddam. Considering my past experiences, our goal in establishing this program is to transform the nature of addiction treatment by offering evidence-based care, focusing on patients and their individual needs in a calming retreat-style setting. The Paramount inpatient program has been a tremendous success. We opened our doors to detox patients in the fall of 2022 and had a residential program up and running by the summer of 2023. Since then, we have seen a steady increase in inpatient volume, working with hundreds of patients from Connecticut, New York, and neighboring states. Through our work in Haddam, we learned that there's a substantial need for aftercare options for patients transitioning out of programs like ours, as well as significant unmet need for outpatient behavioral health care generally in the state of Connecticut. We also recognize the need for outpatient care options, not only for individuals struggling with substance abuse use disorders, but for those with primary mental health disorders and co-occurring diagnosis. Also, we worked on placing patients. We identified Fairfield County as an area with a documented lack of integrated outpatient behavioral health options and rising substance abuse and mental health concerns. It is a place where our patients already live and work. For years, these patients have asked us for step-down outpatient services closer to home within a program that they trust and that already know their clinical story and history. The program we are proposing will directly and immediately fill a treatment gap for outpatient behavioral health services for patients with a broad spectrum of substance abuse and mental health related diagnosis. Like with our inpatient programs, we feel strongly that outpatient care should be provided in an individualized, evidence-based manner by a program and staff who understand that each person's recovery journey is unique. Our proposal has equity and access at its core. We plan to participate with Medicaid, offer charity options as appropriate, and provide culturally competent services, meeting our patients where they are. In short, this proposal is a direct response to documented unmet need, geographic service gaps, high overdose burden, patient demand, and Connecticut's health priorities and Connecticut's stated health priorities. It improves access, quality, coordination of care, and cost efficiency in one of the regions that needs it most. I come before you today as an owner, investor, and a person in recovery, willing and able to help address Connecticut's need for additional behavioral health services. I urge you to approve our CON application for a comprehensive outpatient care center in Stamford. I will now turn the presentation over to my colleague, Cece Rilella. I'm available to answer any questions you have once our presentation has concluded. And thank you so much again, everybody. I appreciate it.
And if I just can, Hearing Officer Novi, Chris, if you're comfortable briefly, could you just tell the OHS staff kind of how you got involved with Paramount and why this particular facility is important to you?
Well, how I got involved starting Paramount was I'm in recovery myself. I was an alcoholic, and when I left, when I was treated, when I left an inpatient treatment facility, I left and went to an outpatient facility that was part of that facility, and they didn't provide good enough services for me to keep me coming back to outpatient. I basically just sat on a couch and watched TV and met with a therapist for 10 minutes, and we had a group meeting for 20 minutes. And I said, this is crazy. Why would I come back here? It's not doing anything for me. So that directly, I ended up relapsing and drinking again. And once I got back on my feet again with the right care, I said, I need to develop a program that is individualized and spends time with patients, the right amount of time with patients. And we don't put patients in front of TVs and only do 15-minute meetings. We want to do as much work as possible with the patient to treat them. So without having this outpatient facility, it doesn't really complete my mission to deliver the care I want to deliver to our patients. So it's really important to me to try and have a full continuum of care, especially one that has primary mental health involved, because I didn't have a primary mental health outpatient involved with my outpatient. And I had some primary mental health issues that I was actually very easily able to cut through once, I was able to go to a primary mental health facility. But having two facilities within, or two levels of care, or two different types of care in one facility I think it would be remarkable. It would have helped my journey a lot easier and made everything more seamless. So that's my reasoning for all this, and I hope you guys can take that for what it is.
Okay, thank you, Chris, for sharing.
Thanks.
And so we'll turn it over to Cassandra. She goes by Cece, Cece Ruella, who will give the next part of our presentation. And I think you have to adopt your testimony too.
Yeah, it's in here. So,
Thanks.
good morning, Hearing Officer Novi and members of the Office of Health Strategy staff. My name is Cece Ruella. I am the Executive Director and the Clinical Director of Paramount Wellness Centers. I hereby adopt my pre-filed testimony. I want to thank you for the opportunity to give brief opening remarks about the need for and benefits of an outpatient behavioral health center in Stamford that will serve both primary mental health and primary substance use patients, offering a continuum of step-down care from partial hospitalization to intensive outpatient to traditional outpatient therapy. For my background, I received my bachelor's degree from the University of Connecticut, my master's degree from the University of Hartford in clinical practices of psychology. I'm currently a licensed professional counselor and a certified advanced alcohol and drug counselor. I spent about 10 years in the nonprofit outpatient space, growing to outpatient administration. And now I'm currently working as clinical director and executive director of Paramount. What I think is very important to note is that having an executive director that is also a clinical director allows for our business decisions to be clinically informed. And I want to say out loud that I'm very grateful for that in our model. Speaking of our model, we are a very clearly integrated dual diagnosis framework, which means that we don't allow for specific tracks to separate at all times. We have one clinical team that will run both types of care, which eliminates the idea of contraindicated care. Anything that would trigger one side, we will be aware of. We also have a whole person approach using holistic modeling with acupuncture, Ayurveda, sound healing, music therapy, etc., as well as the evidence-based care of CBT, DBT, relapse prevention. In addition to that, we also treat medical issues and we screen for those things and we treat them as best as we can, if not referring to our partners. And we look for social determinants of health in order for us to put an individualized treatment plan together. One of the primary reasons that we're proposing this outpatient center in Stamford is a demand for those services in Fairfield County and the neighboring New York metropolitan area amongst our patients being discharged from detox and residential care in Haddam. The need for continuity of care is identified through mitigating the care gap. The first 30 days after leaving a high intensity level of care, suicide is 200 to 300 times more likely. The cliff of fall off for aftercare is something we're looking to eliminate completely. By using the same provider, what we're allowing for, excuse me, is the therapeutic alliance to continue, where clients are 19% less likely to prematurely end their care if they are with providers that they are familiar with and know their histories. We're looking to avoid relapses and we're looking to avoid readmissions, which we've gone into more detail into my pre-filed testimony. Aftercare placement for us, we have an entire case management department that focuses solely and completely on aftercare placement. What we've been learning from our patients over the past couple of years is transitioning out of Haddam into outpatient care in Fairfield County. There are either not sufficient options at that time, the wait times are too long, or the clients are looking to come to us if we had an option, and if there isn't not an option with us, they are refusing aftercare, which leans back into that care gap and cliff of treatment. Our outpatient center is intended to offer comprehensive outpatient care, including the PHP and IOP levels, not just to patients with substance use disorders, but to patients with primary mental health diagnoses as well. To the best of our knowledge, we will be the only private provider in the Stamford area that provides all levels of outpatient behavioral health care to adults with SUDs, MHDs, and co-occurring diagnoses. The numbers really tell the story for us, with approximately 25% of Paramount's discharges originating from the Connecticut and New York catchment areas for this proposal. This represents approximately 100 individuals annually who we know will benefit from the outpatient center in Stamford, a number that we expect to grow as our Haddam census grows and the number of individuals we serve from these catchment areas increases. About 1/4 of Paramount's patients have co-occurring substance use and mental health disorders diagnosed, which we propose to treat in Stamford. We also refer out approximately 180 patients each year who cannot be served in Haddam, either because they have a primary mental health diagnosis or because they don't require the inpatient services we provide at that location. Many of these patients could benefit from the Stanford Outpatient Center, particularly those residing in and around Fairfield County and the neighboring New York metropolitan area. In addition to the need we've identified for our own patients, there is also a significant unmet need for behavioral health services in Connecticut generally, and in Fairfield County in particular. Our CON submissions include data that supports this, including, but certainly not limited to, SAMHSA data that shows 58.9% of 18 to 25-year-olds and 44.4% of 26 to 29-year-olds with severe mental illness have a perceived unmet need for treatment. For substance use care, there are limited recovery support and harm reduction services for people post-discharge and a high need for intensive outpatient care with disparities by race, ethnicity, and insurance status. In addition, the community health needs assessment of the 3 acute care hospitals in the immediate service area supports the need for additional behavioral health service for these 4 area residents. Paramount has also provided letters of support from area providers who recognize the need for the comprehensive integrated behavioral health services that we intend to provide. These providers are committed to making referrals of clinically appropriate patients as needed to our programs. This is in addition to letters and testimonials from former patients about the quality of Paramount services, their desire for a Fairfield County outpatient treatment option. As discussed in my testimony in greater detail, Paramount intends to participate with Medicaid and projects that approximately 11% of our Stanford patients will be Medicaid recipients. We will also offer charity care scholarships in accordance with our current policy and project that 9% of our Stanford patients will be uninsured. The totality of the evidence we have provided OHS establishes
I'm sorry, can I?
Yes.
I'm taking notes. I just want
Okay.
to, I'm sorry.
That's
I have to
okay.
write things down, otherwise I don't. You said, you project 11% Medicaid patients and how many
Yes.
to be uninsured?
9%.
Thank you.
Of course.
Sorry,
Good.
you can go ahead.
Okay. The totality of the evidence that we have provided, OHS establishes a clear public need for our proposal. It will provide immediate relief in an area where there is substantial unmet need for comprehensive integrated behavioral health services. It will enhance equitable access, quality, and the cost effectiveness of our care. For these reasons, we urge OHS to approve this proposal without delay. The people of Fairfield County need the services that we are ready, willing, and able to provide to them. I want to thank you again, and of course, I am available to answer any questions that you may have.
Thank you, and that concludes our presentation.
Okay. Attorney Fusco, any questions for Mr. Ruella?
No, I have none. Now, I may have follow-up after OHS questions, but none right now. Thank
Okay.
you.
At this point, I'm going to ask Steve to unmute. Would you like a quick break before we head into questions, or?
Okay.
No, I think we should be all set. We can start the
Okay.
questions.
Great. So we are going to go into OHS's questioning now, which is going to start with Ms. Harrison, asking some questions, followed by Ms. Viella.
Okay, again, my name is Andrea Harrison. I'm a planning analyst with the Office of Health Strategy. According to our 2024 inventory published on OHS's website, there are approximately 56 providers in the proposed PSA. An additional 2 facilities have been approved since. Did you review the OHS inventory for the PSA towns? And given the difference in numbers we came to, how did you decide what to include or exclude?
Yes, my name is Cassandra Ruella. I'm the Executive and Clinical Director of Paramount Wellness Centers. We did review this in the beginning of doing the CON application. I looked at solely Stanford. Upon receipt of the completeness letters or the requests of the questions, we expanded that, realizing that Stanford is obviously not our only catchment area for a Stanford program. And so that essentially identifies the difference in numbers.
Please explain why a number of these providers and you may have answered this already, were excluded from the list of the first completeness letter response. So I think you said you just realized that Stanford was, you mentioned something a little while ago.
Sorry, my apologies. So when we had looked at it in the completeness letter as well, what we looked for is Greenwich, Norwalk, and Stanford as our primary areas of this service area beyond Stanford. So that is essentially what we focused on.
I have a follow-up question to that. So did you ever expand your search to look at the entire PSA? Or did you just keep it limited to the Greenwich, Norwalk, and Stanford?
Again, this is Cassandra Ruella, Executive and Clinical Director, and we have expanded that search. We do have that list in front of us as well.
And when you did that search, did you include any facilities that we have recently approved, as we have been prolific in approvals?
We included the people who are currently licensed for care.
Okay.
I think it would have captured more recently approved, but we can double check, and we worked off the inventory and DPH licensure status. Looking at those kind of secondary service area towns out beyond Stange Creford.
Thank you.
Paramount states on page 37 of the responses to hearing issues, but they have no comparable outpatient options closer to their homes. Paramount cited an additional 30 established providers in the PSA offering outpatient services, including intensive outpatient programs, partial hospitalization programs, and outpatient program type services. Taking these two statements together, is Paramount arguing that these providers are not an option to patients, for example, because they are not at or above capacity? Or is this an argument that while they have the same license or type, that the services are not comparable? Can you explain what you mean there?
Absolutely. Cassandra Ruella, Executive and Clinical Director. So yeah, the argument that we are making right now is that what we're proposing is essentially two primary diagnosis type with 3 levels of care for each diagnosis. And that is what is not comparable elsewhere, where we can provide substance use treatment, mental health treatment, partial care, intensive outpatient, outpatient, medication management. So the entire full continuum of care for both primary diagnoses under one roof with the same providing team.
So you mentioned it's not comparable. Is there any type of documentation, data, or evidence that these services under the proposal are materially different than what is available from the other providers?
Yeah, so looking at the table of providers in the catchment area, like you were saying, you know, they can have the same licensure type if they have a substance use license. That does not mean necessarily that they offer partial care. They might offer IOP, they might offer outpatient. So we have that table listing what is offered in the catchment area, and we're not seeing that we're not unique in this. We're not seeing an identical version of this.
Can you further explain your statement on page 16 of the application? Currently, the target patient population is served through a disjointed, fragmented system that does not adequately target multivariable root causes.
Sure. Cassandra Ruella, Executive and Clinical Director. So that means a number of different things. Number one is that we were talking about the care gap and the wait times for treatment, which is listed in the CHNA that is cited in our CON application and also in my pre-filed testimony. So that lends itself to disjointed care when what we're looking for is streamlined continuum of care to avoid the drop off of client participation. Additionally, when we're looking at social determinants of health, when we're looking at the variables of root causes of issues, the Stanford location is 5 minutes away from a bus line, which will allow transportation for clients who don't have that. And so I think that there are obviously many places that offer many different levels of care separately. But because we are doing it under one roof, it makes it a more comprehensive approach versus a disjointed approach to care.
I'm just going to follow up quickly. You said you are 5 minutes from a bus line. Is that walking? Is that driving? What would that 5 minutes entail?
Cassandra Ruella, Executive and Clinical Director. It is a 5-minute walk from the bus line.
Okay. Any other public transportation located close to or near your facility?
There's a train very close to it as well. I do not have the numbers directly in front of me. And we will be, yes, correct. We plan to provide transportation for those people who either cannot afford or do not have access to public transport.
And how will that be provided?
Through the agency, we will have a driver.
This is Annie Fiala. I have a quick follow-up on that. Is the transportation free of charge, or does it get charged in a different way? Is it under the billing for the services provided?
The transportation will be free of charge.
Great, thank you.
Will there be a parking lot located next to or near your building where people can park?
There is off-street parking.
Okay.
There's a parking garage right near it as well.
And is that a paid garage?
No, free parking.
If I can just interject, this is Jen Fusco for a minute. As far as the transportation, any transportation plan, because I'm the lawyer, I have to say this will be done sort of in accordance with the law and the requirements around providing transportation, providing free transportation, but there are definitely plans to put a legally compliant transportation plan in place.
Okay. Mrs. Ruella, Andrea Harrison, again, in the Office of Health Strategy Planning Analyst. You mentioned the CHNA, which is the Community Health Needs Assessment. One significant source cited to demonstrate need for these services is the Community Health Needs Assessment for the Stamford area. What years are represented in the CHNA and when was it conducted?
It was the 2022 CHNA because the 2025 had not been released yet upon our submission of this application. And I want to say it's 2018 to 2021 that's reflected.
I think it's the chip for after, so 23 to 25.
23 to
and you looked
25,
at
yes.
the 25 and it was similar.
Yes. Yep.
Okay. Is Paramount aware of how many other facilities have received CON approval since then?
I'm not currently aware of that, no.
Is there additional evidence of ongoing and continued unmet need for these services that you can provide?
Are you asking, for, if I may ask, are you asking for what's beyond in the testimony? I mean, CC didn't go through all of it, but there's substantial evidence in there from sources like SAMHSA data from the OHS State Health Plan. There's a Region 1 priority report commissioned for DEMIS. There are CHNAs. There's abundant data in there that's been cited that we didn't discuss today. Are you looking for information beyond that?
Just so you're saying, I didn't know if you had any information beyond that, or I'm hearing you say that all the information that you have as far as the sources are listed within the information that we have that has been submitted.
Correct. Either in the CO, I'm sorry, Jen Fusco, either in the CON submissions or the testimony itself. Most things are linked.
Okay. Okay. All right, so I'm going to continue with my line of questioning. All right, I'm going to now move on to the referral patterns. There are a number of references to patients coming to Paramount's Haddon facility, so I just want to make sure that we get those sorted out clearly for the record if we can. What percentage of patients at Paramount's Haddon facility reside in the proposed Stamford locations PSA?
I believe I said this in my opening.
I don't know the percent, but it was about 100, I did about 25%.
Yeah, this is Cassandra Ruella, Clinical and Executive Director. As stated in my opening statement, approximately 25% of Paramount's discharges originating from the Connecticut and New York catchment areas for this proposal.
What is the percent of Connecticut residents? That is what we're most concerned about here.
Is in that document you sent me.
Yep. I'm sorry, give me 1 second.
You prepared for us.
That's okay, I have it. Yes. So in 2025, which had not concluded when I ran these numbers, but it was roughly 12.5% for the catchment area of Connecticut.
Is that all of Connecticut or Stamford County?
That's the catchment area that we proposed in the primary service area.
You have the total numbers for Connecticut.
So would it be safe to assume that the other 12.5% comes from New York?
Yes.
Okay.
And we do have the total number of Connecticut discharges if you'd like it by year.
Yeah. Alright,
So
so-
in,
Give you the number if you want.
yeah, it is. In 2025, when running these numbers, 74% of our discharges were from Connecticut.
Okay, because the part, yeah, that was going to be like my next part is, can you provide the total number of discharges for Paramount's Haddam facility, the number of discharges for patients from Stamford City, and the number of discharges from the Fairfield County total, as well as the number of discharges from New York?
So Cassandra Ruella, Clinical and Executive Director. In 2025, we had 382 discharges. Again, this was at time of running this, so this was like middle of December, so maybe give or take a few. 281 of those discharges were Connecticut as a whole. And so that leads 101 outside of Connecticut. 65 of those were New York discharges. I do not have Stamford specific because I focused on the primary service area that we were looking at, and that's 35 in the Connecticut catchment area, 12.5%.
Paramount noted that the number of patients from Fairfield County and New York has increased recently. Has that increase led to capacity constraints or wait list at the Haddam location?
This is Cassandra Ruella, Clinical and Executive Director. No, it has not. Yeah, we started, because we started in 2023 for our residential program, and we've been ramping up. We are ramping up to our capacity, not over our capacity.
Currently, Paramount stated they have to refer out about 180 potential patients per year. Under the proposal, Paramount would treat those patients rather than refer them to other providers. However, Paramount says the proposal will not affect referral patterns in the area. How can we reconcile these two statements?
So again, Cassandra Ruella, Clinical and Executive Director. Many of these 180 clients, approximately, are leaving the state for care because they're not interested in the care that's being provided in that catchment area. And additionally, if someone is like, for example, I've had clients who have left our residential program successfully, went on, they relapsed, and if they're not meeting the criteria for detox or residential, they don't want to go anywhere but us. And so they're not willing to take that care. So they may not be getting care at all. But those 180 clients that we're identifying are the people who don't meet criteria, or we're unable to treat because we don't have a primary mental health license in Haddam.
If Paramount will now treat this set of approximately 180 patients per year instead of referring them, won't that necessarily affect how patients are referred to other providers in the PSA?
Right. So Cassandra Ruella, Executive and Clinical Director, only based on the numbers and the percentages of data that I've provided thus far, only about 25% of that 180 figure is from that catchment area. And likely many of them are not currently receiving care at all because of not being able to come to Paramount. And so I don't believe that it will make more than a negligible difference.
In the application, oh, I'm sorry.
Sorry. So you're saying about 45 patients of those 145 are coming from the catchment area. And
Of those
that is
180, but yes.
of those 180. Now that's just the Connecticut catchment area or the New York?
That would be Connecticut and New York. So likely
Okay.
20-ish if we went by the same factor.
Okay. Thank you.
No problem.
In the application, as well as the pre-filed testimony and as in the testimony as we've been hearing about today, we've heard about there being a need for these services in Connecticut and references to there especially being a need in the Fairfield County. So we just talked about earlier the significant supply of other providers within the PSA. And when looking at Exhibit A that was submitted, pages 1084 through 1086, it looks like the illicit drug, when looking at illicit, the general totals for illicit drug use, heroin and cannabis, looking at those numbers in the PSA, they're lower than the statewide average when looking at those numbers. Given that lower rate and seemingly greater supply of services, what makes the need for Fairfield County especially important in terms of services in the Fairfield County area?
Cassandra Ruella, Clinical and Executive Director. And while I can see what you're noting is that we're also looking at mental health, and I will remain focused on the comprehensive treatment that we plan to give, because it's not just the prevalence of the drug use, which I love that we're a little lower than the statewide average, but we're also looking at mental health and the co-occurring disorders. And if we can provide that all in one treatment continuum, then what we're looking at is a lower likelihood of relapse and readmission.
Okay, I just have a follow-up on that. Actually, same page 1085 of Exhibit A. The estimate of significant mental illnesses incidents in Connecticut in your proposed PSA is actually lower than all of Connecticut as well, and also the estimate of major depressive disorder. So you stated that there was a co-occurring, but with those low rates of drug use and the lower rates of mental health issues in your county, plus the fact that we've also required that Norwalk Hospital keep open their inpatient psych unit, kind of justify all of those together for us.
So Cassandra Ruella, Clinical and Executive Director. Having an inpatient psych unit remain open is wonderful, and also not the level of care that we're looking to provide. And so if they're in inpatient psych care with Norwalk, they're going to need some place to go following that. We're willing to provide that. We're ready and able to do that. Additionally, looking at the major depressive disorder table, being lower than the statewide average by 0.8% is wonderful, and also not exorbitantly lower, right? And what we're looking at again is moving away from the prevalence of, even with this lower quote unquote prevalence rate, there's still a very high readmission rate and relapse rate. And we're looking to lower that with our comprehensive treatment.
Okay.
Yeah, I also want to say this as well. Cassandra Ruella, Clinical and Executive Director, and I wasn't sure we had the data in front of us, so I didn't say it, but now that we do, there's also an estimate for the state right now of 51,470 people who are untreated because it's underreported. And I believe that that's worth taking into account. As far as Western Connecticut, we have 13,861 people. And the metropolitan area, we have 7,500 people. And those numbers, based on this source, those numbers are likely underreported as well. And that's the state health plan. I also, I want to share too, we have experience with psych units who have asked us to open outpatient mental health units because their stays are very short and they're unable to keep them for the amount of time that people need that treatment.
On page 42 of the pre-filed testimony, you cited a table of unmet need from the statewide healthcare facilities and services plan. The data incorporated in that document were the most recently available at that time, but they are from 2021. Again, there have been significant changes in the provider landscape in Fairfield County since that data was published. Do you have any data or evidence that the unmet need continues to exist, or that the increase in providers has been insufficient to meet the unmet need?
Yeah, Cassandra Ruella, Clinical and Executive Director. It's not in our wheelhouse to know the utilization capacity of those approved programs. What we do know is our capacity and what we've been asked to do and what we can provide for these people. I also don't believe, and I don't have data to support this, I will provide it if needed, but opening new programs in this county does not change the amount of underreported treatment.
And if I can just interject, I mean, this data comes from the 2025 state health plan put out by OHS, correct? And they were only able to get data through their consultants. You were only able to get through your consultants' data current through 2021. So this is the best data you're offering us to analyze off of, and whether there are some new providers, it's clearly not changing the landscape in a way that we can quantify if the consultants who put this out in March of 2025 couldn't get more updated data. So we're working with the best publicly available data that the agency has put out.
Okay. All right. Paramount states on page 37 of the pre-filed testimony and issues response that based on Paramount's data, as well as research and studies regarding the lack of sufficient behavioral health services capacity in the PSA, what research and studies are being referred to in this statement?
Everything that's linked in the C1.
Cassandra Ruella, Clinical and Executive Director. What's being referenced here is all of the supplemental data that we've linked in the CON application or in our responses or in our pre-file testimony. To clarify, we're not referencing anything that has not been submitted.
Thank you. Those are all my questions.
Thank you.
Um, I do have, I'm sorry, I have one more questions. Several times it has been referred to, references have been made to patients who have refused follow-up care because they don't want to be referred to providers who were not Paramount, um, who were not Paramount. Do you have any numbers or data about the number of those patients and whether they want to and are able to travel to proposed locations for those services?
Cassandra Ruella, Clinical and Executive Director. I do not have clear data points on that. What I do have is my experience in the last 2 years. We've also submitted a letter of support from a client who chose to leave the state instead of coming to us for treatment. And so in my experience and in the client's experience, that is a prevalent likelihood for our clients.
Okay. At this point, I'm going to go ahead. Andrew, do you have any follow-up questions or?
No.
Okay, so I'm gonna ask that we take a quick 10-minute break. We're gonna come back and Ms. Viola will finish up her questions before we break. Oh, I'm sorry. This is Hearing Officer Novi speaking. Before we take our break, I would just like to remind anybody who is listening from the public, if you would like to make a public comment, please sign up in the Q&A. You can list your name and that you would like to make a comment, and Ms. Ventus will put you onto a list for public comment later on. Let's go ahead and take a 10-minute break. I will see everybody back here at 10:37. Again, please mute your microphones and turn your video off if you would like to not be recorded during the break. Thank you.